Good afternoon, everyone. My name is Dr. Shana Dorazan. I am the Venture Acceleration Manager here at Matter. And today I'll be talking to you about how we support healthcare startups in our ecosystem, helping them to not only get the mentorship that they need, but to get to market as soon as possible. All right, let's get started. First, I'll be talking about Matter. And so at Matter, we have our mission of accelerating the pace of change of healthcare. We are really committed to getting solutions, innovative solutions to the market as quickly as possible so that we can help as many people as possible. And we believe that we can do that through collaboration. And so we believe that this is the most effective way to accelerate not just innovation, but to advance care and overall improve and save lives ultimately. And so we do this in a very unique way. And so the way that I like to think of it is that Matter serves as this community nexus for all the different stakeholders. And so by serving as this nexus, we can bring folks from different parts of the pipeline into the same room together so that they can engage in a way that accelerates this innovation. And so here at Matter, I like to say that we have two sides of the house. We have our corporate innovation side, and this is where we help large health organizations to either internally innovate or to source solutions that will help them innovate. On the second side of the house, we have the startup incubation side, and this is where I sit. So this is where I work one-on-one with startups to get them the resources that they need in order to build an expansive network, to be a part of a great community, and again, to give them the resources that they need to build their solutions and to get to market as quickly as possible. So to date, we have created one of the largest healthcare communities. And so we've helped over 1,000 startups from all over the world. So we are a Chicago DNA organization, but to date, we've helped 1,000 startups all across the world. We've worked with over 143 large health systems, and we've helped our startups raise $5.3 billion in capital. And so we have over 60,000 people in our community, and we would love for you to be a part of that. On the right-hand side of the screen, you can see that our startups are broken down into these different sectors. Majority of our startups are within digital health, but if you fall under that healthcare umbrella, we can help you. And so we have a smattering of life sciences, so therapeutics, diagnostics, med devices. We have some services, so helping to improve the implementation of healthcare. And then we have 5% that aren't quite perfectly categorized in any of the above categories. The partners that we work with, we have over 30% in provider services, we have life sciences, associations, foundations, payers, university, health systems. We partner with as many folks as we can so that we can get these innovative solutions to the places where they need to go. And like I said, we are a Chicago DNA organization. We're headquartered here in Chicago, but we have a footprint all over the world. And so last year alone, we helped 272 startups. We partnered with 51 of our corporate partners, and we've been in 117 cities, as well as 11 countries. So again, our reach is expanded not just nationally, but internationally as well. And this is just a sampling of some of the industry leaders that we've partnered with to date. All right, let's get to what you all are really here for, the member experience. So what do you get when you come to Matter, and how are we able to help you all to get to market faster? And so our approach is built on these three pillars. So building your business, raising capital, and then eventually gaining traction in the market. Building business. You can have a fantastic idea, but if you do not have a solid business that surrounds it, it's going to be really hard to engage with all the different stakeholders within the ecosystem that you need to in order to get your innovation to where it needs to go. And so making sure that you have a solid business around your idea is paramount. And so through this, we have mentorship and coaching. We have experts that you can access and talk to really hone in on your strategy, make sure that you are building things in the right way, and to put you on the best path for your company. For raising capital, we have a robust fundraising program where we help you get ready for conversations with investors. And I'll go into more detail about that in just a moment. And then finally, gaining traction in the market. So once you are prepared, once you have raised that funding, you've got your business settled, you've got your MVP or what have you, we want to connect you to potential customers and partners who will help you to, will either help you continue to build out your innovation or to eventually use your innovation in their workflows. And so, how to start your journey here at Matter? Online application. So you go to our website, you'll complete an online application. There is an internal review for about a week or so. And so this comes to the ventures team. There is a rubric that you're scored against. These take into consideration the problem, the solution, whether the solution in your, whether your solution fits the problem, your business model, your marketing strategy, your team, whether we have the resources to actually be able to help you at the stage that you're at, and so on. And so these aren't really measures of like, okay, how far are they along? Can we, are they a high potential startup? These are really just for us to understand, okay, where your company is at. And so, and to best match the resources that we can to get you to the next step. And so we will score you on this rubric. Once we score you, if you meet the threshold for an interview, then we'll invite you out for an interview where you'll meet with me and some members from my team. We'll ask you questions about your application, really get to know you, your background, why you started the company, and just clarifying different aspects of your application. After that, we'll take all that information, we'll send it up to leadership, who then has a final say as to who gets into the portfolio or not. That usually takes about a week. And if you are accepted, there's onboarding, so there's paperwork to be completed. But then you have a discovery session with me and my team. And so this is where we really go into all the details, nitty-gritty details of your company. So your business model, your financial situation, what your runway is, what traction you've gained so far, understanding, okay, what mentorship or what expertise do you need for mentorship, and so on. And so we really want to dig into the nitty-gritty details of all that you are so that we can best support you. In addition to that, we have a roadmap. We have a proprietary tool that we've developed in the last year where we'll have you fill out an assessment. And then this assessment will then, after you set your goals, pull all the resources from across different sectors and put it into a personalized roadmap just for you. And then we continue to build together. And so going into detail about how we support our startups. And so in terms of mentorship and coaching, each member in our select portfolio is paired with an executive in residence. And so this person is going to be your longitudinal mentor for your entire journey with Matter. As you continue on through your milestones, you might be in need of a different executive in residence, and we can definitely swap you as you continue to progress. But this person serves as your go-to person for strategy and guidance. Your executive in residence will have an expertise in whatever your most challenging area is. But say you might need someone in a different area, let's say regulatory. We have an expert clinic, and this is where we have over 100 subject matter experts where you can come and pick on. You can think of it as office hours, where you can tap them for their expertise in any particular area, whether it's clinical trial development, whether it's regulatory, reimbursement help, whether it's selling into hospital systems. We have folks that you can talk to, get that advice, take all that information back to your executive in residence, and then continue to optimize your strategy. And then you'll also get support from the Matter team. So not just me, I serve as the account manager for all the members in our select portfolio, but you'll get access not just to our ventures teams, but the entire organization and our network. In terms of fundraising, like I mentioned before, we have a robust fundraising program where we help you get ready for conversations with investors. And so we have you work with investors to get what we call investor ready, so that then we can put you in front of more investors. So breaking it down just a little bit, I have my colleague Elle, who is a fundraising lead here at Matter, as well as two venture fellows who are not only serial entrepreneurs, but they are investors themselves. So they have sat on both sides of the table and they understand as an entrepreneur what they need to bring to that table, and as an investor, what they're looking for when they get to that table. And so we really help you hone in on your fundraising strategy. We help you to develop the materials, so your pitch deck. If you have a data room that you would like for us to take a look at before you, let's say, enter into a due diligence talk, we can give you some feedback there. And then really honing in on your pitch practice, right? So making sure that your pitch matches what you have in your pitch deck and that you are conveying your message in a way that is appealing to investors. And then once we deem that you are investor ready, like you are prepared for these conversations, we do have a network of 27 VCs that we work with on a preferred basis. And so we will facilitate introductions where appropriate. And we have a wealth of other on-demand resources that you can tap on, including our digital curriculum, where you can watch modules to really learn more about healthcare. We have our professional services directory. So if there's any work that you might have to outsource, there are consulting firms, law firms, what have you, in the professional services directory that we have vetted ourselves, and so that we know work well with startups as well as price well with startups. Everyone in that directory has committed to giving our members a 15% discount. And so you know that you have a trusted source of work that will come your way. We also have the knowledge library where you can access different templates, resource guides, frameworks for whatever it is that you might need. So whether it's building out a team, maybe building a lean startup, we have materials and articles there that you can tap on to really beef up your knowledge in those areas. And then through our portal, you can access the subject matter experts that we have through our expert clinic. We also have TeamUp, which is a service that we've partnered with MDisrupt to offer you all. So if you're looking to build your team in any way, you can tap them and they will do that talent search for you. And then you'll be a part of a very dynamic community. And so as a select member for this particular membership, you'll get access to member exclusive opportunities, such as webinars with industry leaders, talking about selling into health systems, or really engaging with different folks within the ecosystem. If you're not in Chicago, but if you are ever coming to Chicago for a conference, a different event, an investor meeting, or what have you, you have a headquarters away from home. And so you'll be able to access our co-working space as well as to reserve our conference rooms and our event facilities. And then you'll have access to our Slack channel, both general and private channels. I'll talk about it in just a moment, but there are two different membership types. The select membership, which is the membership that I have been talking about, you'll get access to both the general and the private channels. And the flex membership, which I'll talk about in just a moment, you only get access to the general channel. And so these are the different membership tiers. The select membership, which I have been talking about this whole time, is our most inclusive set of resources. With $400 a month, we do not take any equity from the companies that we work with. There are no additional fees, and this is a month to month. You can cancel at any time. And so you can build your business with Matter, including all these resources that I've laid out here for you today. There are instances, though, where you might not be able to take full advantage of all the resources that are offered in this particular membership. Let's say you are a serial entrepreneur, but this is the first time you've done it in healthcare. And so that is why we have our Flex membership that provides all of our online resources at a nice low price of $30 a month, where you can take your time learning about healthcare, doing it at your own pace, on your own time, learning all that you need to know about the healthcare space, and then graduating up to select, where you can take advantage of all those all those additional resources that we offer. And that is it. Thank you so much for your attention today, and I'll be more than happy to take any questions. All right, so yeah.
Sorry about that. I have a very particular question. I don't know if it's appropriate in front of everyone, but basically it just happens. So I'm with Maggie. And we're a health tech company serving preeclampsia and pregnancy. company founded in 23, based in UK, and we're coming to North America, and we hope Chicago to be the home for our North America operation. A question that I have, I'm based in Chicago, but the co-founders are based in Europe, and it just happens that today and tomorrow, one of the co-founders is here. Is there any chance at all that we can meet you today or tomorrow?
Uh, I am at an event today, but tomorrow, if you can come to the space, we do offer tours. I there are set times that I offer tours, but I also do one-on-one, so ad hoc. So please take my email down, shoot me an email, and then we can coordinate.
We'll do that. Thank you.
Yeah, absolutely. We did have a question about the talent search. So the team up option, that is at an additional cost. So you get access to uh, MDisrupt. They do a lot of the work. They you fill out a form detailing what it is that you need. That form gets sent out. They do the search for you, and then they come back with 2 to 3 candidates that you can then interview, and then decide on who you think would be the best fit for that position. Once that's set, MDisrupt sorry, MDisrupt will handle all of the back office work. So making sure that the contract is in place, everyone gets paid appropriately, things like that. And that comes at an additional cost outside of the membership. All right, we've got a question from Vicky. Can you elaborate more on the help we can seek from mentors? Say we need help on reimbursement strategies, would the mentors be able to help working with our team, or will we likely be referred to the professional services team? Great question, Vicky. Thank you so much for sending that in. So your executives and residents will be able to help you with that strategy, right? So it's not so much they're going to help you execute. So like not working one-on-one with your entire team to make sure things get done, but advising you on that strategy, giving you all the bits of information that you need to know, especially from someone who's either gone through it or who is currently doing it. All right, we've got a question from Sylvie. I hope I'm pronouncing that okay. How would the membership support startups relaunching a medtech therapeutic solution post-COVID in Germany and US? Main support on fundraising strategy needed. So would like a little bit of clarity on the post-COVID part of your question. But in terms of the fundraising help, you would, in order to enroll in our fundraising program, you'd fill out what we call the actively fundraising form. This is where we collect information about your current financials. Have you raised money before? How much have you raised? Do you have any saves? So like what type of equity have you given out to folks? Things like that, just so that we have a clear understanding of where you are and can best give you the advice to navigate from there. And then once you fill out the form, you'll meet with first L and then eventually both L as well as our 2 venture fellows. And then the initial session is you giving a pitch for about 10 minutes and then walking through slide by slide, detail by detail, asking questions, having you elaborate, and then giving you feedback so that you can go then iterate and then come back. We find that startups typically have at least 2 or 3 sessions with our fundraising team before we are able to put them in front of investors.
No, this is Sibylla. I was the one asking the question, but we can take it offline, and I have your email. But it's basically a relaunch because COVID shut down all ICUs. And that would kind of put that company in insolvency because in Germany, they didn't have these PPPs we had over here in the US.
I see.
Yeah. So
yeah. That is an interesting situation. I have not yet encountered a startup that has relaunched, but I can definitely refer you to the SVP of Ventures, Mike McGarry, who has been in the industry for over 30 years, and so can probably shed a bit more light on how to kind of get restarted.
Exactly. Thank you.
Yeah, for sure. All right. So Karen is asking about the selection criteria for determining whether a particular startup could incorporate into the Matter portfolio. Yes, great question. So there is a criteria of 10, there are 10 different criteria that we look at. So the problem, like what is the problem that you're solving? Is it something that will help improve the delivery of healthcare or to help the healthcare outright? So make it help, wondering whether your solution is innovative, whether it's really going to move the needle within the healthcare space. That's something that's really important for us to look at, and whether your solution matches that problem. Is it the most appropriate solution um, to solve that problem? Then we look at your team, right? Does your team have the experience to bring the solution to market? We also look at your business model. Does it make sense? Like, again, we have companies in the portfolio who have gotten in on an executive summary, right? But just detailing, okay, what your plan is, that is the most important thing. Making that clear to us so that we understand how we can potentially help you. Your business model, right? Who are you looking to target for a customer? What strategy are you thinking about implementing? Your marketing strategy. What's your go-to-market strategy? How do you hope to get to market? There are 5 more. So coachability and traction. So have you gained any traction in the market? Have you raised any funds before? Um, what is there anything that you have done that would lead us to believe that we would be able to work with you, right? Being able to use and implement our resources in a timely manner so that you can get to your next milestone in appropriate time. There are a couple more that I'm missing, but the last one that I can think of is good fit, right? So whether or not we actually have the resources to support you. So Matter, we're a nonprofit, we are mission driven, and we want to be able to help the people that we can help. But if you are a company that might be, if you're outside of our scope, or maybe we are really far along, and we might not have the resources to match what it is that you need at the moment, then that's something that we also take into consideration as well. We don't want to waste your time. We don't want to waste your money. And so we want to definitely hone in on making sure that we can actually help you. So we do have a question. So yes, so the startups have to be selected, and then you pay the membership fee for access to our network. So that's for the select portfolio. The select portfolio, there's, again, you walk through that criteria, you get evaluated there. There's an interview process, and then all that information goes up to leadership, and then they say yes or no as to whether you get into the portfolio. Once you are in the portfolio, you do pay that membership fee. For Flex, you can just sign up for Flex. I like to call it the Netflix of our resources. And so you can sign up, cancel anytime, and all that. And that's the Flex membership. All right. Well, those are all the questions that we have for today. Thank you all again for your attention. My email is on the screen. If you have any questions, if you would like to schedule a tour, or if you just want to know a little bit about Matter, a little bit more about Matter, please shoot me an email. I'll be more than happy to chat. Take care.